Good evening students. I am Divya from Global College of Nursing. Today we can see the topic postpartum hemorrhage. Okay. Before going to the topic, I'll give some small introduction regarding the postpartum hemorrhage. Postpartum means it is a period after delivery. So what you mean by hemorrhage means excess bleeding occurs. So the postpartum hemorrhage means excessive bleeding occurs after delivery. Clear? This is the meaning of postpartum hemorrhage. Next we can see the definition of postpartum hemorrhage. The definition is given by D.C. Dutt. Okay, this is the definition of postpartum hemorrhage. Any amount of bleeding from or into the genital tract following the birth of the baby up to the end of the puerperium, which adversely affect the general condition of patient, evidenced by rise in pulse rate and falling blood pressure. This is the definition given by D.C. Datta. Definition means major, severe. Then normally there are two types of postpartum hemorrhage. The two major types are primary postpartum hemorrhage. Okay, what do you mean by primary postpartum hemorrhage means the bleeding occurs within the 24 hours of delivery. Postpartum hemorrhage, there are three main causes. First one is atonic causes. Then second one is traumatic. Third one is retained tissue. Then fourth one is blood coagulopathy. First we can see one by one. First one is atonic uterus. In the atonic uterus, malnutrition that will also cause postpartum hemorrhage. Then anemia if the mother HB level is decreased, that will also cause postpartum hemorrhage. Then APH means antepartum hemorrhage. The bleeding occurs before delivery, that is APH. The next, prolonged labor. If the labor will be prolonged means that will also cause the postpartum hemorrhage. Then malformation of uterus. Any malformation occurs in the uterus like unicornate, bicornate, septate, that will also cause postpartum hemorrhage. Then uterine fibroid. If the mother having uterine fibroid means that will also the causes of postpartum hemorrhage. Then any changes or abnormality occurs in third stages of labor, that will also cause PPH. Then precipitate labor, combined duration of first and PPH. Then what are the traumatic causes of postpartum hemorrhage? In that, first one is operative vaginal delivery like forceps and vacuum delivery will also cause postpartum hemorrhage. Then if the mother having any perineal or vaginal or any other cervical tears, that will also cause the PPH. Then lower segmented tears also cause PPH. Then uterine rupture. Then LSCS, lower segmented cesarean section, that will increase the risk of getting PPH. Then episiotomy wound will also cause the PPH. The next, what are the next causes? Retained tissues. In retained tissue means any bits of placenta inside the uterus, that will also cause the excessive bleeding after delivery. The next one, blood clots. Any blood clots occurs in the uterus, that will also cause PPH. Then abruptio placenta, it is one of the type of antepartum hemorrhage. Then if the patient having any jaundice, increased risk of getting PPH. Then HELP syndrome. This is the causes of postpartum hemorrhage. Next we can see what are the risk factors of PPH. First one, prolonged labor. Then multiple pregnancy. If the mother having more than one children at a time of in the uterus, that is the multiple pregnancy. Then episiotomy, incision made on the perineal area during the time of delivery, that is episiotomy. Then fetal macrosomia. Then if the mother having previous postpartum hemorrhage, that will also the one of the risk factor for postpartum hemorrhage. Then the placenta previa. Then pregnancy induced hypertension or PAH, infection. This is the risk factors of postpartum hemorrhage. Then what are the signs and symptoms of postpartum hemorrhage? First one is the patient having severe vaginal bleeding, then tachycardia, then altered level of consciousness during the blood loss. The patient have altered level of consciousness, restlessness, drowsiness. The patient have severe fatigue, then swelling and pain in perineal area. The next, diagnostic evaluation for PPH. How to diagnose PPH? First, history collection ask the patient regarding the previous history of PPH. Then physical examination, we should identify the vaginal bleeding. Then do the complete blood count. Then USG, ultrasonography. These are the diagnostic evaluation for PPH patients. The next we can see the prevention. How to prevent postpartum hemorrhage. In that, first one is antenatal prevention. In antenatal period, we should improve the health status of mother, providing proper diet and health education regarding the health status of mother. Then second one is identify high risk patients to develop PPH. We should identify the high risk mothers like twin pregnancy, hydromnias. Hydromnias, there are two types, oligohydromnias and polyhydromnias. Then grand multipara, then antepartum hemorrhage, then previous history of postpartum hemorrhage, anemia. These are the high risk mothers we should identify during the time of antenatal period. Then next, third one is placental localization. During the time of pregnancy, we should identify the placental localization if the placenta is situated properly or correctly. The next one is intranatal prevention. First one is active management of third stage of labor. During the time of third stage of labor, we should actively manage and slowly done the delivery. Then in the case of induced or augmented labor by oxytocin, we should continue at least 1 hour. The oxytocin drip will be continue up to 1 hour. Then woman delivered by cesarean section, we should provide oxytocin 5 units slowly IV. Then exploration of the uterovaginal canal. We should, after delivery, we should explore the uterovaginal canal. Any bits of placental or any blood clots will be inside the uterus. We should check. Then after that, observation for about 2 hours. Then last one, examination of placenta and membrane. We should check the placenta and membrane clearly if any bits are inside the uterus or not. Okay. During the time of pregnancy, during the time of labor, we should empty the after the delivery, we should empty the uterus. Then after, if any, palpate the fundus as well as the uterus to make hard. Okay, how to palpate the uterus means the massage is done by placing 4 fingers behind the uterus and thumb in front. Then we should provide crystal NS or RR solution with oxytocin 60 drops per minute. Communication, resuscitation, monitoring and arrest of bleeding. Okay, this is the management for true postpartum hemorrhage. In this true postpartum hemorrhage, there are actual management. In that first step, the massage the uterus to make it hard and express the blood flows. If the uterus is soft, means we should massage the uterus to make hard and it should be express the blood clots. Then administer the injection methoxin 0.2 mg given IV. Then provide injection oxytocin drip is started at 40 to 60 drops per 1 minute. Then after that, catheterize the mother bladder and monitor the urine output if the urine output is normal or abnormal. Then after that, we should examine the expelled placenta and membrane if any bits of placenta will inside the uterus or not. Then